Welcome back to NiteBites. I'm your host, Clark Garen.
And I'm your co-host, Denise Oliver.
Well, you just listened to my filibuster. What do you think of the president's speech and health care? What's your take on it, Miss Denise?
Well, about his speech, I appreciated his speech very much. I felt that he engendered a lot of hope and optimism as far as letting people know that he's sincere in his efforts to change the health care or reform health care as it stands right now. Because the fundamental thing is this: there has to be a reform in health care. There has to be.
Why?
Because we can't continue to not insure so many of our citizens in case of catastrophic illness. People going to the emergency room for regular illnesses. The emergency room is for emergencies. It's not for people that don't have health insurance, and then we have to pay those bills.
But the emergency room crisis is not as much caused by people who go in to treat it for colds as all the gunshot victims who come in from gang wars.
I don't think there's that much trauma in the emergency room. If you go to any typical emergency room, you got people going there for normal, ordinary fall down, bumps on their head, common colds, the flu, things like that, because they don't have health insurance. We're paying for these people who, if they had insurance, could go see their regular doctor, but we're paying these exorbitant fees for them to go to the emergency room. They don't need to see an emergency room doctor. They need to have regular preventative health care so that they can be productive citizens of society, and we don't have to pay all their bills. I think it's ridiculous, and it's sucking our economy down. I think that's the biggest drain on our economy is health care. You can say what you want about the banking industry and not liking Obama and him picking your pocket, because your pockets are pretty full from what I see. I'm upset because I don't want my hard-earned money going to pay for all these people going to the emergency room. Let's insure them. That's like having a bunch of people driving around with no insurance in their cars and hitting you. Yeah, we know that happens too. That's why you have to get uninsured motorists. That's ridiculous. Everybody should have insurance for their cars, and everybody should have insurance for their health care.
Okay. What about the people who say they can't afford it? Do you want to pay for their insurance instead of their health care?
Everybody, the people that cannot afford it, obviously the government is going to have to put them in some sort of a program where the government subsidizes it, but it will be preventative care, and it won't be nearly as expensive as them going to the emergency room.
And where is the government going to get this money?
From the insurance companies that now have to compete with each other, with all these new people that are going to come in, and they're going to be trying to get these people as patients, as customers. They're going to lower their premiums, which is going to save the rest of us money, and we can pay more to the government.
And I bet you believe in Santa Claus and the Easter Bunny, too.
Yeah, no, I don't, which is why I don't believe he's picking your pocket, because your pocket is pretty full, Santa.
Okay. Well, but seriously. The problem that I see is, I would like to see more people be insured.
It's not a question of like. We have to.
Well, but the key is, do you really think that it is all the uninsured people that are responsible for the dramatic increase in your health premiums and my health premiums?
I think it's the greed of the insurance companies, and the fact that in so many instances they have a monopoly because they don't have a lot of competition, which is why I think government-sponsored or public option is a good option, because that introduces more competition. And if you have more people in the marketplace and more companies that can service these people, then the rates will go down. And of course the drug companies have to get in line too, because the drug companies are just a bunch of robbers anyway. So they need to get in on the game too, and the government needs to regulate them as well. There are so many players to this thing, but the whole thing is that there needs to be reform because it's huge. And we as a country cannot sustain the burden of all these people that are not insured. Eventually, the chickens are going to come home to roost. Eventually, they're going to drag the entire economy down with them.
Okay. Do you believe that the reason our premiums are escalating are the cost of servicing all the uninsured people, or the greed of the insurance companies who are providing us our coverage?
Both.
Which do you think is more responsible?
I don't know. That's a good question.
I will tell you, I think it's the greed of the health insurance companies and the hospitals and the drug companies that are primarily responsible for this crisis. Now, we've been hearing about how the cost of health care keeps on going up dramatically. But think about your own health care. Your health care, your family's health care. What is the most, besides the premiums for the insurance, what is the largest cost of health service that you get?
Medicine.
I mean pharmaceuticals.
Yes.
Drugs.
Yes.
Okay, I agree. That's the same thing with me. You go in to see the doctor. He maybe charges you $100 or $200, maybe $500 for some tests, and then you're spending $1,500, $2,000 a month for years for the medication to treat this stuff. It's all going to the drug companies.
Okay.
And this is why I say our crisis is brought on by this government system that's bought and paid for. When they gave the Medicare people a prescription drug benefit, part of the legislation was the government was not allowed to negotiate with the drug companies over the cost of the drugs. Now, for example, one of the biggest pharmacies in the world now is Walmart.
Yeah.
You go look at Walmart, and their drugs are really inexpensive. I'm not going to say cheap because that implies there's something wrong. They're inexpensive.
Yes.
Because Walmart negotiates volume prices because they buy in volume. Nobody buys in the volume of the government. Medicare, Medicaid consume 40% of our health care budget.
So what if that's a provision?
The provision says that the government, even though they're consuming 40% of all the drugs, they cannot negotiate for volume discounts with the drug companies.
You mean under the current Medicare?
Under the current law, yeah, that was bought and paid for by the drug companies.
Okay, so under the Reform Act...
They're not doing anything about that.
Really? Because he referenced that in his
He
speech.
referenced it, but the legislation that is going through is not correcting it. There's a big difference between what he says he's going to do and what gets through the Congress, just like he said he was going to give us bankruptcy reform, and he didn't do it.
Sorry about that, Clark. I know that was personally a big blow to you.
No, it wasn't a big blow to me. It was a big blow to some of my friends who are stuck in homes that they owe twice what they're worth.
Oh, well, walk away from them.
And that's what they're starting to do. But I think that it is completely immoral to allow a bank to take over a house and sell it to a stranger when they could sell it to their borrower and realize the same profit. But we're talking about health care. You're right about that. That's just, I keep on bringing that up because that's where I got disconnected with this administration.
Yeah, and we just should have had a show in the 8 months between the first one and this one. That's true, because now you've got all this stuff that you want to say. And I'm like trying to get you back, and I should just let you talk after we take our break.
Well, we're going to come back and we're going to talk about health care some more, so please stay with us.